So I want to come back to the psychological risk factors because inherent in this is the solution to the problem. All right. So risk factors for the development of IBS. We talked a little bit about this before, and again, there's so much more information in my bigger course about this. So I'm just giving you overviews here. But family history of IBS, childhood trauma, are influences. Mood disorders like stress and anxiety, maladaptive stress response. And I want to talk about that for a minute. What I mean by that is that stress is a normal response to certain types of circumstances, all right? And some things are stressful to everybody, but the level of stress that people experience is highly variable. And people can change the level of stress that they experience in response to things, okay? So again, this goes back, remember my example of Brussels sprouts. Everybody in the building has gas. Some people are more uncomfortable than others, and the IBS patient is wildly uncomfortable. Okay, so something stressful happens. You know, it could be a death in the family. It can be a failing grade in a class that you're taking. It can be an adult child who's made a decision that is not, and that you think is a bad one, right? There can be all kinds of things involved that cause stress. And gosh, we've been experiencing a lot of that lately, all of us, right? But some people become more stressed than others. And for some people, that increased stress, again, same circumstances, different stress levels, can really be an influence on IBS. And then low-grade inflammation, that can be a factor as well. That's the one physical symptom. Chronic stress not only can influence visceral hypersensitivity that we talked about, but it can cause dysbiosis in the microbiome. It can increase visceral sensitivity, contribute to IBS. Abnormal gut bacteria interact with the immune system and the nervous system, which can cause GI dysfunction. And so repairing the microbiome might be a key to resolving IBS. And probiotics are, compared to drugs, relatively inexpensive, not harmful to anybody, more helpful if you're talking to somebody who knows a little bit about them and can put you on the right probiotic, but certainly nothing bad about taking them for a while. The presence of at least one psychological disorder is reported as high as 80% in IBS patients. A strong relationship exists between the severity of IBS symptoms and psychiatric disorders, particularly depression and anxiety. Major life traumas are often reported as prior to, like the thing that triggered it was that something happened. And again, the perception of that something can be different. I mean, I know people who've had horrific things happen to them who have processed it and they're still affected by it. I think that you don't make that go away, but they've moved on in some ways, or they're reflecting back on it is less impactful than somebody else who's had a lesser event, right? So anyway, that's an issue. Early life adverse events associated with IBS, people who've been in foster homes, children who've suffered from abuse, conflicted homes, that sort of thing. Severe illness, death of a parent death of a parent's really traumatic for kids, as you might imagine. Stressful events can actually worsen the abdominal pain. Abuse history, stressful life events. I mean, I would imagine for IBS patients, I mean, I've heard this from people who were talking to about IBS during this last 14 months, but the symptoms of everything appear to be worse right now during this whole COVID thing. So our IBS folks tend to be a little more uncomfortable than maybe IBS people we were talking to 2 years ago. IBS does tend to cluster in families, which means that some social learning may be a potential mechanism. Again, the issue of illness is a way to cope with life, all right? And there's a name for it. It's called secondary gain. And I'll give you an example of this. We worked with a family here years ago. And sometimes, I watch what goes on in families, and I try to be respectful and not say too much, but in any case, what was going on in this particular family is a little boy, 8 years old, who had divorcing parents. And in my opinion, both of these parents were incompetent, all right? Completely incompetent. They seemed to be focused on everything other than this child. And most of what they were occupied with is this drama that they're going through. And even when they came in here, it seemed like there was more conversation about their drama than there was this little boy who constantly complained of stomach pain. And in talking to the parents and kind of figuring out what was going on, I'll tell you what was going on, and then I think it will tell you exactly what I'm talking about. So this little child would complain of pain, stomach pain, sometimes so severe that he had to be taken to the emergency room. In fact, there had been, I don't know, a dozen or so emergency room visits during the last 15, 16 months. Both parents would end up in the emergency room. And but nobody could ever find anything wrong with the child. In fact, the parents said that some personnel in the emergency room seemed to know them and were getting a little frustrated with constantly bringing this kid in. But he would complain that his symptoms were so severe that that's where they would end up. And so what I think was happening, right, and what was happening actually, is that the only way this child knew to get his parents' attention is to claim that he had stomach aches, severe ones. And he learned over time that the more severe they are, the more likely you are to go to the ER. And if you go to the ER, both of your parents are going to be there. And so isn't it a shame? First of all, it makes you want to cry that an 8-year-old has to do this to get attention from his parents. That's pretty awful, right? And the second thing is that if something doesn't happen, I don't know what happened with this family, but if something doesn't happen, what's happened during childhood is the child has learned to use illness as a way to get attention. And that's the wrong way to get attention. But you do it enough and you don't just, I've said this about eating habits, I've said it about everything, and I'll say it about this. People don't become 18 years old and say, well, all that behavior that I exhibited as a child, now that I'm 18, the bad eating, I'll just stop doing it, or the learned illness to get attention, I'll stop doing it. I mean, at some point in time, it has to be dealt with, and sometimes it's in adulthood when somebody has IBS. And then health beliefs and coping skills contribute too. And by health beliefs, I mean, and I fault the healthcare system for this to a certain extent. We make people think that, if you have a pain in your elbow, oh my gosh, you better check it out. It could be bone cancer. And, if you have a headache, oh, nobody should ever get a headache, particularly if you're eating well. It must be something wrong. You should go check it out with a doctor. People are really hypersensitive to anything that goes wrong with their body while ignoring the main things that are going wrong with their body. They don't drink enough water. They don't eat the right foods. They don't exercise. They're gaining weight, so they're worried about hangnails. They're not worried about the whole rest of everything else that's going on. So health beliefs can make somebody much more susceptible to this whole thing too. Personality types, neuroticism is not fun. I don't recommend it to anybody, but it makes people more reactive to stress, and it's very consistently found in IBS patients. And fortunately, neuroticism is something you can get rid of if you want to. IBS patients also tend to have lower levels of openness. And of course, if you are sexually abused or something bad happened to you, you can certainly understand that than the general population. One of the most significant predictors of pain intensity is pain catastrophizing, and that's magnifying the threat or seriousness of pain and the feelings of helplessness. So, and again, everybody deals with something differently. One person has a headache and says, I'll take an aspirin and forget about it. Another person has a headache and says, I hope it's not a brain tumor. The more catastrophizing, the more pain, the greater risk of this becoming a disabling type of situation. So worrying is associated with emotional experience of pain and suffering. So you can worry yourself into worse health. You're worried because your health is not good. And then the worrying makes your health worse. It's a circular thing that you have to interrupt with counseling, actually. I mentioned psychological stress or even a traumatic event sometimes precedes the onset of disease, and it's bidirectional. Okay, something bad happens, that causes the disease then causes the psychological distress. And so patients who develop IBS over time, they develop worsening scores for depression, anxiety, somatization, and neuroticism. Somatization, again, is the tendency to report multiple physical symptoms and to attach a lot more significance to them. It's common in IBS patients. Many people can go to work when they have a sniffle and a headache, and some people have to go to bed when they have a sniffle and a headache. And I'm not making a judgment about it, I'm making an observation about it because Being miserable over a sniffle and a headache is not a great way to live. And most people don't like being in that situation. They would like to be more confident about their health.